in what ways does teenage pregnancy affect responsible parenting? Welcome, Dr. Nturi.
Thank you very much. And I must appreciate for having invited me to this very important topic. I usually never miss this type of conversations because I believe for a nation to be able to develop, you need to invest to the children, but also you need to respect and invest into the families, family being one of the very important institutions. So what we have learned in the recent past, there have been a couple of challenges, especially when it comes to the early childhood investment. As a result, we ended up having the workforce which is not competitive, which is not ready to be able to take up opportunity should the opportunity present. And that has been the reason why whenever I receive invitations around early childhood investments, talking about policy, being a policy expert, this is what really I like speaking most. But the science tells us that, or shows that life is a story for which the beginning sets the tone. So life is a story. This is what the science tells. It's about the 1,000 days, which actually encompasses from the conception to the first year of a childhood. But that's not enough. Going up to the 8 years, this is the time when a child actually acquires a number of skills which are important ones to be used later in their lives. And I'm glad that even the definition of health of WHO of 1948 spells out clear that health is a state of complete physical, mental, and social. So the world is social. When you abandon it, you end up having a nation which is not going to be productive. So for us to have productive nation, to have productive people, we need a human capital. And the human capital begins from the early childhood investment. So that's the reason really I feel very much passionate talking about the early childhood investment, but the policies associated with it. So the government of Tanzania has done a tremendous job in terms of formulating policies and also trying to analyze policies that are geared towards making sure that we have the very vibrant workforce. One of the very important one is the one which was developed by the community development, Ministry of Community Development, but that was not developed alone. It did involve other ministries, the Ministry of Health, Prime Minister's Office, the stakeholders. I'm glad in this panel we have colleagues from UNICEF, but also from Girls Effect. So we had a couple of stakeholders who participated in formulating those policies. So the policy which we are using right now, it was formulated pastorally by engaging different stakeholders. So what do we have right now? We have the policy that supports to have early childhood program in the schools, but also at the community level. Rita spoke a little bit about the community program, which the project she's heading is implementing. That is a result of the existing policy, that you cannot just focus on those who are in schools, but also you have to deal with those who are out of schools, because both they will be able to contribute into the national productivity, because we understand that the brain growth takes moment by the moment, but the crucial time is within the first 1,000 days. And this is what the government has tried to do. So now with the new policy, people or stakeholders are allowed to have even the centers at the community level. They are allowed to have centers in schools, but also they can have both combined. And that is what we have been trying to push for that agenda. But not only that, I had the privilege to be appointed by Her Excellency Dr. Samia Suluhu to be one of the members of the drafting team for Tanzania Development Vision 2050. But I was assigned one very important pillar that I'll be drafting on, and that is human capital and social development. In that area, we spelled out very clear the importance of having early childhood centers and also importance of investing into a family as an institution. I know we have single parents, I know, but when you go into the definition of a family, it goes beyond having both the paternal and the maternal side. You can have one parent, but it's still forming the family. So the investment has to start from there, because the family is key to the early childhood development. And this message has to transcend to the different people so that they can understand that if you miss the opportunity of 0 to 8 years, then that's going to cost a child in terms of school performance, and that's going to cost a child in terms of productivity later in their lives. So the issue we are having at hand, we're a youthful nation, and also we have a youthful continent. 65% of Tanzanians are the ones who are below 24 years of age. And these are expected to be able or to be very productive so that to contribute into the national GDPs. If you do not invest into those who are between 0 and 8, then you won't be able to get a productive workforce. You'll have a population of escorters instead of having the population of contributors. So with this topic which we are discussing today is quite very pertinent, and I would love really everyone in this room to be our ambassador so that you can take this message out there, the importance of investing into early childhood. So we understand that these investments are touched into emotions, are cognitive, and as well as social. And the pillar which I'm writing, which is on this human capital and social development, it does insist China, Western countries, which we consider to be the best performers, they have done very well in terms of the early childhood investment. So we need to follow that. We need to emulate that. And these type of conversations should steer us forward or towards having the systems that support that one. So in terms of policy we have. Now in terms of the teenage pregnancy, we are performing poor in that area. With the current data, we have 22% of teenage pregnancies. Initially, prior to the census of 2022, we had 27. So we have dropped by 5. That is not enough. And this varies considerably across the country. When you go to the Lake Zone, where I spent 5 years, it has gone close to 50%. So we need to invest because, again, those who bear children in the Lake Zones, their median age is 15, 14, 16. That is not enough to prepare them to be able to provide responsive caregiving to their children. So we have to think the best way, how do we take care of this group of 22%? Because otherwise, you're going to be having the vicious cycle, and it's where now the issue of poverty comes in. But the government of Tanzania, they have tried their level best to come up with some programs and initiative to address poverty. And we have the Tanzania Social Action Fund, TASAF. It has been there. And the beauty is TASAF, they have helped us to identify the poor and link them into the social services. But again, the burden of poor people in the country is huge. 26% of Tanzanians are living in abject poverty, which translates to about 17 million people, those who cannot afford a single dollar per day. So we have to have multifaceted approach to address this challenge, because we know what poverty can do to someone. You have to take care about it. And that's why I'm very happy with what my sister Rita is doing, not only addressing the social issue, but addressing the economic issues as well, because we know poverty can be a driver to many challenges, including the disease conditions. So in a nutshell, what I wanted to say that we have very good policies in place. And for adolescents, we have NAIA, which takes care about the issue of sexuality, reproductive and sexual health for the adolescents. And we understand that the access, universal access to sexual and reproductive health among adolescents is still low at 28%, while the Western countries and other continents, they have the universal access to sexual and reproductive health for adolescents at 48%. So still we need to work together so that we can uplift that. But not only that, the nutrition status among the adolescent, young women, and the women of reproductive age is not well in terms of obesity, but also micronutrient deficiencies. All these ones need to be put together, to be packaged together for us to have a nation, because an anemic mother will deliver a child who won't be able to realize its potential when he or she grows up. We have to make sure that we also address those ones. So I thought I should talk about that, but we have very good policies in place. We have good programs in place. All what we need is now to walk the talk and try to translate these policies into action. Thank you.
Yeah, this is Dr. Ntuli. I think you can hear from him. He's teaching us, he's telling us, he's informing us. What is it going on in the real context in this country? And remember, the director of preventive health in the Ministry of Health, what he says here is assurance of the government, that the government is looking this aspect of responsive parenting, and I'm sure these things have been taken on board. He has told us the importance. Again, I said, as parents, you are either a parent, you are either about to be a parent, you have been a parent, and if you have been a parent, perhaps you expect grandchildren. I can see some of the people here, my friend Suleiman Kimate and the others. You expect grandchildren. So taking care also of grandchildren is critically important. In our context, as Rita says, we are the extended families. In African context, we have collectivist culture. That's quite different from our fellow, where they have individualist culture. Most of us, you have collectivist culture. So we look at the children as extended families. So this means a lot in terms of caregiving. Congratulations also for being trusted by Her Excellency Dr. Samia Suluhu Hassan to be appointed to be a part of the important team that looks at the vision of this country and for representing us in issues of human capital and the social development. He reminds us to investing in families, and we'll be discussing with him, perhaps interacting with him. Now everybody is going to be an ambassador. So thank you very much, Dr. Ntuli, and a clap for him once more. The next speaker is going to be Enune Msemwa. Enune Msemwa is also an important commentator in this meeting, given her position. Enune Msemwa serves as early childhood development specialist at UNICEF Tanzania Country Office. She provides technical leadership in early childhood development programming, research, advocacy, networking, and the partnership building, as well as capacity building and the coordination. Before that, she worked as a social welfare and the case management officer at the World Education in cooperation supporting community health and the social welfare system strengthening at the national and the subnational level. So you see, she's highly experienced and she has worked vastly in the area of early child development. And as you all know, well, UNICEF has been supporting this country for quite a long time, supporting aspects of child development. So we really highly welcome her to this presentation. A clap for her coming here. Enune is going to tell us some key aspects of early childhood development, including responsible caregiving. And she's going to tell us why is responsible caregiving important for early childhood development. Why is it important to invest in this area? And the second thing she's going to tell us is how does responsible caregiving for early child development apply to children with the disabilities and illnesses, or children living with the difficult situations that I believe they're in this country. And she knows much better than we do. Welcome.
Thank you so much. Good morning, colleague, and I'm happy to be part of this important panel discussion. And let me just, because of time, start with going directly to our topic today on responsive caregiving. And I've been told to share with you why responsive caregiving is important, especially in early childhood development. So before I go directly to the why, let me reflect a little bit on what is it when we talk on the responsive caregiving. So responsive caregiving, I think our moderator also just highlighted that responsive caregiving, we talk of there are three key concepts, or not, which you need to remember when we talk of responsive caregiving. So we talk of the ability of the parents, one, to notice, second, to understand, and third, to respond. So we need, when we talk of responsive parenting or caregiving, we have to remind that those three key issues need to be there. Ability of the parent to notice, understand, but also response to different unique needs of the young children. Our young children have different needs, and these needs are, according to the nurturing care framework, there are 5 key needs which are very critical to support holistic development of the child. One, the child needs good nutrition. A child also needs good health. A child needs opportunity for early learning, but a child also needs responsive caregiving, but a child needs safety and security. So these are the key basic needs for the young children to develop holistically. So there have been a challenge in that most of the other component which I've mentioned, there are specific sectors which are working on that. But responsive caregiving is mostly the responsibility of the parents, to ensure that it's the parent who can respond, identify, and understanding the needs of the young children and support the whole development. So those are the things which we need to understand now to see how we support our caregiver and parent to ensure that they support the holistic development of the child. And through responsive caregiving is where nutrition need can be met, health need can be met, early learning needs can be met, and also safety and security needs can be met only if the parent is responsive and understand all those needs of the young children. Now, why responsive caregiving is very important, especially in early childhood development. I think one of the big important our director, Dr. Ntul, has mentioned, for its responsive brain is fueled by good nutrition. Those all 5 components I've mentioned, responsive enough, can provide all, can also support the fueling, and so it also support to build the confidence of the child. And if you can even just realize the confidence child, it's an investment which has been made by the parent who is responsible. It can also support a child to understand different things around the environment which he's facing. So just because of time, just to summarize that, responsive caregiving is very important for early child development because it creates the foundation of learning to the child. Now we are talking of the challenges of like a child is completed even standard 7 without even knowing how to read and write, because the investment at early years has not been done. So it also very create a foundation for learning, but foundation for good health. We are saying we are spending a lot of money and for health because the foundation for good health was not like built properly in early years. That's why different diseases a child can start facing early in early years. Nowadays there are a lot of young children which are now are also wearing glasses. And most of the time I say, why at this age? A child is class 1 glasses. So those are the challenges. If we invest in responsive caregiving, it means also we create the foundation for a good health, but also for productivity. Dr. Ntul also has mentioned that for create the productivity, and through that we are all building a good foundation for the development of the young child. And from the recent data of the Tanzania Demographic Health Survey, it indicates that Tanzania, it's only 47% of the young children they are on track. Where are the 53%? So we can ask ourselves, where are the 53%? Almost half of the young children of Tanzania, they are not developmentally on track on health, learning, and psychosocial support. Why? Because we have not invested enough on responsive caregiving. So it's our role, it's the call upon us that we need to invest and support our parents so that they provide proper responsive caregiving to their young children. And the best approach which we can use, because responsive caregiving is not in any of the sectors, is to ensure that we integrate responsive caregiving in our sector programs and strategies and policies. I'm happy to hear that Dr. Ntul is also our champion for ECD and has been managed to ensure that even the Vision 2050 has a component on ECD. So the government now realized that we really need to ensure that we do a heavy investment in this. So integrating responsive caregiving in our sector-specific program will also support to ensure that our parents and caregiver understand the importance of responsive caregiving and take action. And the second part was on the how about children with disability and other vulnerable children. So we are saying that responsive caregiving is more on trying to meet the unique need of the young children. But these children with disabilities and most vulnerable children, they have more needs than other children. So how can we support them? We can only support them if parents and caregivers are aware on how and how they can take care of their young children. Especially issues of identification of their disability early in life, but also how they can support. For instance, we have also those children who are living in the institution, and unfortunately, those children, they don't have like one-to-one responsive or love or care. They are cared by maybe one caregiver. They are 50 or 20 or 25. So I think there's a gap, especially for these children who are most vulnerable to, they miss the responsive care. That's why you find most of the time we say those children who are like orphaned, they're in the orphanage, they are children with disability. Sometimes they are locked in their houses. They cannot even access those 5 components we are saying. And how can they support the parent to understand that this child with disability need more responsive support than even the normal one? Because through responsive caregiving is where you can provide more services, understand the child challenges, and see how you can support and seek referrals and other support out of the context. So just to summarize, because of time, my urge to you, and I know mostly here we have people from the health sector, and I pose the question to you, how can we support parents? Health sector, we are saying, is a unique position sector which can support almost 100% for the responsive caregiving. Through the RSH services, you meet a lot of parents there. Do we have that parenting programs to support parents understand how they can take care of their young children? Pediatrician, now I'm happy to see Dr. Teo here, who is also our champion for ECD, and they've done a lot of integration of ECD into the health services. So it's a call upon us that through health sector, let's think, what are we doing? And I'm happy also Dr. Ntuli is here, and since he's our champion, he will also propagate to ensure that within health sector, responsive caregiving is well integrated, and the parents and caregiver who are most of the time we charge from 0 to 8 to almost 5 years they attend health facilities. How do we support them to get this knowledge? So to conclude, I can say that if we are not doing anything for health sector and other sectors, let's do something. Let's also, all of us, especially who are here, plan to do something on responsive caregiving. If you are doing a little, let's do more, so that we ensure that our young children develop their full potential. And if we are doing more, let's do better, so that we ensure that the 53%, that one which they are not developmental on track, they are also on track, so that by 2050, we have our young children in Tanzania, 100 or 90% they are developmental on track. Thank you so much.
Clap again for her. Thank you, Elinune, for telling us about the importance and the critical period of human development, which is food of thought for us to understand. So I think we get some few minutes for discussion. Perhaps they may come back to you. The next speaker is going to be Dennis Ngie. Perhaps I suggest that you be very brief so that you get time for interactions. This is a senior sociologist who served as a social welfare officer for many years, for more than 14 years. He has served in different as a coordinator in different committees, in different structures in the district. He started working at the lower level to the highest level, So he's a vastly experienced person in social welfare issues. The main question to you, Dennis, is what are the key roles of social welfare officers at different levels, including the regional, districts, ward levels, on responsive caregiving for early child development? This is the key question to you.
Thank you very much first for being invited in this important Tanzanian Health Summit meeting. It's my first time to be here, so I'm very happy. I'll be so quick to respond on that question. As we know, social welfare officers are the key custodian of child protection as per Child Act of 2009. But we know that we have a national multi-sectorial EC program, as my fellow colleague has mentioned, which have that 5 components of making sure that the child or nurturing care is being implemented at a holistic manner. So the social welfare officers are the coordinators of this program at all levels, but they are the one to make sure that all those components are being well implemented. And I can say that the issue of responsive care giving was not or is not given a priority in some of the areas you can see. Some of the parents have just left that role to their fellows. As you know, women are the ones who are given a key role in nurturing our kids. But this program needs the collaboration, needs the fathers to be responsible for their nurturing, but also to respond on what the kids are in need of. As she said, you need to be able to understand the emotions, but also the social need of your child, not just to provide. You know, we are very good in providing some materials, but we are lacking some of the components to make sure that we are having an ample time to speak, to talk with our kids since day one. When I say day one, since you plan for the pregnancy. We also have that role of coordinating the implementing partners. As you heard that we have been so cooperative with Girl Effect, but not only Girl Effect who are implementing some ECD program in Arusha region. We have EGPAF, we are having D3, we are having SOS. So you can see all these stakeholders, all these partners, they have their key areas in that 5 components. So at the end of the day, we find that we are really having like a very good teamwork, but also collaborative or responsibility, which give us the opportunity at least to reach more areas, to reach the community through community engagement, because some are in communities like Girl Effect, they are based more on the community to create awareness through bonanzas, through radio stations, and we have been even having like a sport and the sport in radios where they can where they are recorded by using that tune of the mother language, the mother tongue, maybe if it's Kimeru or Kimasai or Kiiraki. So it has been so helpful for the community at least to get to know what is really important. But also we are having that challenge maybe at the low level of having enough number of social welfare, because at the region we are having like only 43 social welfare officers, while we are having like 158 wards. And our focus is at least to make sure that we are having social welfare in each ward, so that they can step in to make sure that the community knows, the society knows what's important when it comes to early childhood development. Thank you.
Thank you very much, Dennis, for that brief presentation, which is critically important to know those people who are on the ground. Yes, so there's what are they doing there on the ground? We all attest that they are very important. The last speaker, before we get at least 10 minutes for discussion, to be as brief as possible, will be Eliezer Eliud. This is a young male parent who has changed a way of supporting his wife in caring the child as a result of the Mzazi Hodari intervention. This is an intervention being conducted by Girls Effect in different areas, including Arusha. So he's here with us from his home village, coming here along the way to ensure that he talks with us. I talk with him in Kiswahili and I may briefly translate. Eliezer, unaweza ukatueleza ukatuambia unajua nini kuhusu huu mpango, na kabla ya hapo ulikuwaje, na baada ya hapo kuna mabadiliko yote tunayoyaona? Tafadhali wajulishe hawa watu.
Asante sana. Mimi kabla ya mradi huu chochote, na kwa mila zetu sisi wa Masai na sheria ama taratibu, kijana aliyeingizwa jandoni huruhusiwi ama haitakiwi kijana aliyeingia jandoni kuambatana na mke wake ama kufanya shughuli zote za nyumbani. Lakini baada ya kupata elimu hii kutoka shirika la Girl Effect Tanzania, nashukuru sana Mungu kwa walimu wangu hawa na ni wazazi wangu. Wamenifundisha wakanikuza kiakili, kihisia, pia namna ya kutunza familia yangu na kumjali mtoto wangu. Nilikuwa hivyo nikaendeleza na masomo yao na elimu zao. Imenibadilisha hatua kwenda hatua, imesababisha mpaka mtoto wangu ananipenda haswa. Nampeleka mke wangu kliniki. Nilivyogundua, maana ili shirika limenikuta kabla mke wangu hajabeba ujauzito. Kwa hiyo mke wangu alivyobeba ujauzito nikaenda naye kliniki, mpaka madaktari wanashangaa, wanasema ni mwanaume gani huyo wa Kimasai, hatujaiona tangu kuzaliwa kwetu. Walikuwa wananihudumia vizuri, wananipa huduma ya haraka sana kwa sababu niko na mke wangu. Hata ikafika sehemu mke wangu anajifungua niko naye. Theater alivyopelekwa kupigwa operation, alivyotolewa, mtu wa kwanza kumuuliza mume wangu yuko wapi? Akaambiwa huyu hapa. Kwa hiyo ili shirika sana limenitoa mbali. Imenitoa kwenye mila zetu ambazo yani ukikutwa ama unafanya shughuli yoyote hapo nyumbani kama kufua, kupika, ni adhabu ama kutengwa na jamii. Lakini mimi walikuja wakanitenga kwa sababu niko karibu na mke wangu, lakini nikachukua moja kichwani nikasema ni sababu ya elimu niliyopewa. Maana ingekuwa sio elimu ningemtenga mke wangu na mtoto angezaliwa ningemtenga naye. Lakini elimu hii imenisababisha kumpenda mke wangu na mtoto pia. Namsaidia kupika. Ni ajabu sana mwanaume wa Kimasai kuingia jikoni, lakini mimi naingia. Napika na anakula vizuri na anashiba. Anashiba vizuri. Pia imefanya akanipenda na yeye. Hata ukimkuta njiani kama wewe ni kijana, una pesa zako, ukamwambia dada nakupenda, nakwambia na mume wangu bwana ananipenda zaidi. Kwa sababu napika chakula, nafua nguo za mtoto. Mpaka mdogo wangu ananipigia simu, yuko Dar es Salaam. Ananiambia ni mwanaume gani unafua nguo za mtoto? Nikamwambia hii ni maendeleo niliyopata. Ni kwa ajili ya mtoto wangu baadaye. Baada ya miaka 20 mtoto wangu atakuwa vizuri tu. Atanipenda, atanikumbuka. Akienda hata popote atasema ule ni baba yangu. Atanizawadia zawadi, akimpa mama 500 na mimi 500 inaingia hapo. Kwa hiyo ili shirika limenitoa mbali sana na elimu hii imenitoa mbali. Kwenye jamii watu wamenitenga, lakini niko pamoja nao, niko pamoja na mke wangu. Waliniambia nimfukuze nikamoe mwingine, nikasema huyu simwachi. Huyu hapo ushuhuda mzuri sana. Asante sana.
Asante sana Elieza. Mama, simama wapongee mkono watu. Huyu ndo mama anayezungumza.
Simama mke wangu kipenzi.
Hataki niishie kusema mama anataka, ameongeza huyu ndo mke wangu kipenzi, yani mke wake. Kwa hiyo this is a testimony that we get from the community, and Elieza has traveled so far so that we all witness this. It would be interesting hearing more, but given we have 5 minutes more, at least we get the comments from the audience. 1 minute. Can we take the mic around? 1 minute each for the comments. Take note, we'll be having 2 minutes to comment.
Okay.
Thank you. My name is Eden Matthew. I'm working with D3. My question goes to Dr. Ntuli, one of my mentors as well. He really inspires with what he does. I understand that the government has done a lot in the space, particularly on putting the policy and on ECD. It has recently launched the National Multi-Sectoral Program, which is a really good thing. And as the moderator said, you are all in the Vision 2050. We know it is true, without competent Tanzanian, without ECD, we may not achieve. So I want to know what more can we do in terms of institutionalizing ECD practices. I've been to Asia and India and other Asian countries where these practices have been embedded in their day-to-day lives and affairs. You find there are special buses for women, pregnant women, special buses for children. So these things, people grows and see them happening in their society. It's not like something that we come and learn. I came across ECD 2 years ago when I was working with D3 on ECD project, and I've studied all this. I've gone through the academics, everything up to masters, but I've never come across ECD. So I wonder what more can we do? And it is a generational impact. So to me, I think that is what I'm looking to hear more from you. Asante.
Good afternoon. My name is Angela, Dr. Angela from Jubilee Health Insurance. My question goes to Madam Rita. So we've seen the results of the program in relation to response caregiving. But I work with a group of women who are learned, but they also don't have this kind of knowledge in terms of raising their children. So how do you think such a program can also affect even us, like when we're learning, especially in the era where we have digital knowledge, we have so much knowledge being shared online, how this information can also help such women? Thank you.
Hello, my name is Murtaza Muhammad Yusuf. I'm a YAP member from the EFH in Tanzania. The baseline data shows that previously, male was not involved directly in taking care of the children, but the Girl Effect created a project to address such things. So I would like to know that how difficult it was in terms of the programs and to the community around there to change the situation. Thank you.
Thank you. My name is Dr. Joseph Masenga. I'm working with the USAID Young Mama and Mtoto as Technical Director. My question goes to my brother, Dr. Ntuli. First, Elinuni, she said that asks the question for health people, but my brother, the area that you are working on, the Vision 2050, I think we need also to consider other sector beyond health. So maybe do you think there is an opportunity to feature in the document how agriculture is featured on that aspect relating to food security and then nutrition? How is education is also featured, because it's also a part of the ECD, and then the community development, which is not currently under health. Thank you.
Hello. Thank you. My name is Kalugila Remam, working with THS. The Chief of Part for USAID Police and Prison Project Healthcare. Thank you, Girls Effect. I think it was an interesting story or interesting forum, simply because of the topic. All of us, we are parents, we are fathers and mothers. My question is, when we talk about responsive caregiver, what really is the definition? We know at the moment children get away from our control at early stage, kindergarten at age of 3, age of 4. So when I'm looking in terms of the caregiver, how is Gelo Effect focusing on those teachers, focusing on those church leaders who are, I can say, mostly engage with these kids almost the time when they are active, and over the night the parents meet them at home, and others at the boarding, even at primary school. So I would rather want to see how Gelo Effect are streamlining with those key actors. But lastly, go to my brother Dr. Ntuli. We had a forum looking how can, yes, it was on how can we have a responsible approach in terms of addressing issues on pediatric children and adolescents. And one of the issues we came to understand, as a country we have a lot of documents sitting at different sectors. Ministry of Finance, they do have those guidelines. Ministry of Health, Ministry of Agriculture, someone has mentioned, and social welfare. And the most key gap was how are they being harmonized, institutionalized. So my call to Dr. Ntuli is how can we do sector integration so that whatever we are planning can bring the impact. Asante.
Asante. My name is Martha Mkona. I'm a newborn specialist. I will spare Dr. Ntuli, but I will direct my questions to Rita and Nsemwa. One is, how can we work with healthcare profession? Recently, the RSH booklet has included the ECD component, but that information is not uploaded, I can say. Like, we don't get enough data being uploaded, for example, from HMIS, so that we can get how many, for example, the proportion of children with ECD that have been detected and what has been done. And the people who are using it the most are the nurses, more than pediatricians. So an area where you can work with is to empower the nurses to identify these children early and support them. And if we can have their data documented, we can know the magnitude of a problem. Gelo Effect, and maybe the psychologist. We are focusing, as Dr. Ntuli has said, on the 27% of those who are living beyond the poverty line. They don't have much, we cannot give them money. But we have a middle class. They have money, but they are using it wrongly. The affluent. A child of 2 years has a mobile phone, is locked indoors because the environment is not safe. We are producing adults that are children. How can we help them? They have resources, but they cannot work. We are focusing on a Gelo Effect. We are forgetting a man. The adolescent pregnancy that we see, the culprit could be a young boy who is not well empowered. So those are the areas that we can work to improve better. Yes, thank you so much.
Yeah, so I think I have two questions which are in relation to and I will respond to the last question, and also someone asked about how are we ensuring we are reaching the others. So in our methodology of implementation, we have a number of communication channels that we use. So we have the parent sessions, which the male parent was talking about. He went through the parental sessions, which are on ground. But we also have other interventions that are ongoing. One of it was mentioned by Dennis, the radio program, which reaches vast number of people. So the poor, it's a mix, because the radios are the ones that are very local, community-based radios, where the community at large in Arusha can access those stations. But also we have another method of, we have a call center number, which is an interactive volunteer, educating the community on responsive caregiving. And also we have live talk shows, which happen in Arusha, where we have experts and they are able to answer questions from the community concerning ECD. And so that also is a comprehensive approach which we are using in Arusha, making sure that we are meeting all the categories. So it's not only poverty, but also the middle age, and also even the parents who have the funds, the money, they are able to get access to this type of knowledge and the importance of this. But in our facilities, where Dennis was talking about, also we have trained providers who have these skills. So any parent who goes to the facilities, they are able to access that kind of knowledge and get access to that. Thank you. I will leave Dr. Ntuli to respond to the other questions.
Thank you very much. I think you need to do more on the social media. We have a youthful population. 65% are those below 24 years of age. So you need to do more on social media. So maybe regarding the question which was asked by Eden, well, as part of drafting Tanzania Development Vision 2050, I've been assigned to work on the human capital and social development. And the social development component, it does include education, water, and it does include the social protection as well as health and nutrition. But I also participate in some other pillars for agriculture, the economic sector, and also the issue to do with climate change. So it's a comprehensive exercise, but I've been assigned to take care of the social development component. So what can we do? For me, I would say the issue of ECD, let us go into a campaign. I'm a campaign guy, and I believe in campaigning. Sometimes these things which we have, they do not resonate very well with the people when they are in these papers and other things. We have the Mtuniafia, we have HPV campaign, we have we have had a number of campaigns which have successfully actually been accepted by the community. So with this one, because it is something which is of great importance to our nation, let us design a campaign. We have a variety of stakeholders in this house. Let us work together so that we can have that campaign. The other thing is to do with the food security and food systems, agriculture and other things. These are also included in our Tanzania Development Vision 2050. We shall start the validation exercise next month and would love you guys to participate on that. With regard to the documents, we need to unpack this document. We need to use mainstream media, we need to use social media to explain to people. People hate difficult languages. They want simple languages. I said the youth, you'll never get majority of them in the mainstream media. You get them in the social media. So we should segment our population. We need to stratify our population. Where can we send our messages and to be well accepted? Otherwise, I should thank you very much for having this opportunity to talk about this very pertinent issue. By being a member of the board for Tanzania Health Summit, would love to have this type of conversation year in, year out. Thank you very much.
Time is out. word.
I'm told to say one word. Please let me say 3 words. For parents, I think even professional people, we are parents. So when I say parents and caregiver, for all of us, I think from the experience from the young parents, I just want to summarize that parents and caregiver need time, but they also need knowledge so that they can support their young children. And last, they need resource, and we need to see how we work on this one.
Thank you. Neno moja la mwisho. Moja tu.
Asante sana. Cha kuwashauri hasa vijana wenzangu, cha kuwashauri sana, tuwapende wake zetu, tuwapende watoto wetu, tusiwatenge. Tusiwache, yani tuwape watoto afya, watoto wetu wawe na afya bora, tuwapatie lishe bora, wawe na ulinzi na usalama. So unamuona mtoto anarukia kwenye soketi ya umeme, unamwacha tu. Tumweke mtoto katika hali ya ulinzi na usalama. Pia tuhudhurie kliniki. Pale unapogundua mke wako ni mjamzito, turu baredisi vitari. Nenda naye hospitalini.
Asante.
Asante sana.
Last word.
Thank you. And for me, it's just to insist the importance of family. Family is very important when it comes to nurturing care. And when I'm talking of family, I'm talking of father, mother, and the children. That's very important. Well, let's avoid separation. Let's avoid divorce for the betterment of our kids. Thank you.
Thank you very much. A clap for them while they go. Other information you can get them from the social media of Girls Effect. That's Instagram at Tujibebe TZ and the Facebook at Tujibebe. A clap for them while they go down, and meanwhile the THMS should come. THMS people. THMS. Very fast photo.